You're pretty good at just giving out information. At least for now, we should be good.
All right, so here we are. Our second attempt at a live view broadcast. And so bear with us as we go through the process, but we're going to look at some cases today, talk about some of the aspects within the industry that are kind of holding patients captive, but also that are we're trying to resolve so that patients get the most ideal treatment according to their needs and not just put every patient in a box. So I'm excited about this, our second attempt at this. So bear with us as we navigate the software and our kind of infancy in this process. So today let's take a look at the process of, and I've got Memo Hea here. He's behind the scenes guy that runs everything, just incredible at all aspects of marketing and really knows the industry well. And so I'm excited to have Memo here with me as well. So
it's going to be good.
Yeah, absolutely. So we're going to look at some cases here. So let's see. Again, bear with me as I... All right, so this is a patient who... all right. So this patient kind of is a good example of somebody who's gotten lost in a kind of a broken system. He, as you can see from the images and the x-rays, I mean, he needs a lot of work. He's had a lot of work done. I mean, he's probably got over $100,000 invested in his mouth already. And now and he's at kind of ground zero. He has to redo everything. And so he's going to spend another good $100,000 or more just because of he's having to repair and fix some of the stuff that's been done. And so let's, as I look at the second image, so this is kind of a typical classic scenario where there was not any planning. These implants were placed kind of with the knowledge of the fact that everything else was failing. So what's the point of these 3 implants here? Without looking comprehensively at the case itself. So it's not necessarily the oral surgeon's fault, but there's no quarterback. There's nobody managing this case. So because as we look up in the upper left-hand corner, when we're looking at an x-ray, it's kind of swapped. So where the implants are would be the left side, and where that bridge on the upper would be the right side. And so by putting those implants in on the upper left, I mean, I can see what they're trying to do is give the patient some teeth to chew with on that left side. However, he has no teeth in the back. So it doesn't really help the patient a whole lot by putting those in. It could have been probably planned a little better, but the fact of the matter is there wasn't somebody in charge of the case. It was kind of going in between different doctors, and so it ends up that the patient, they're kind of just going along with whatever the doctor says. They're not going to dispute. They're going to go, okay, you know what's best, you know what's right. So so he went ahead and had those implants placed, and then a few months later, I'm not exactly sure the time frame, because this is a patient who comes from, and how I found him was through YouTube, but he has been stuck in this no man's land, and he's on the East Coast, and is actually going to drive out to California for me to finish up his case, because he's just stuck in this scenario. So now my point with that is I don't know exactly all of the timeline details, but we'll just kind of go through and look at the case specifically. So here he is now today. He's got a few more implants. Not really, I don't see a plan here. I don't see a, prosthetically, I don't know, because there's not one. That's why I know that. if you just pull teeth out and stick implants in without really planning out the case and knowing exactly where the prosthetic or the teeth need to go, you kind of end up in situations like this. So, I mean, it's fine, and we'll give him a beautiful, final smile and prosthetic, but at the end of the day, there's really not a lot of planning that went into this case. And the only reason I show this case is not to kind of, not to criticize anybody else or any other, disciplines or doctors, but, it's just so typical within this industry because, the way that it works right now is you have a general dentist who refers the case to an oral surgeon. Usually oral surgeon or periodontist places the implants, then it goes back to the general dentist. And if the general dentist doesn't have a plan on where he's headed, because at the end of the day, you got to know where you're going in order to get there, And if they don't really know where they're headed, implants end up in really weird positions and locations, and and at the end of the day, the patient is the one who suffers. And that's really where the all-on-4 and these corporate centers comes from, this broken system. That's literally where it comes from. You get a bunch of venture capital or, guys that sit around a table and decide, hey, this is a great industry, this is a great market, but how do we dumb it down and simplify it to the point where we can put it in the hands of doctors, or whether untrained or newbies that are just getting into it, and have a more consistent process. So they want to eliminate the potential surgical error. That's why they only put 4 implants in the safe zone in the front of the jaw. Stay away from the nerves, stay away from the sinuses. So thinking at it financially, economically, and not necessarily looking at it as like what's best for the patient. We've seen this,
Yep.
multiple times in the office. So, and that's literally what the all-on-4 is. I mean, it's just a way to get implants in fast in a really safe zone, but it doesn't think about the biomechanics of the mouth and how it works. It doesn't consider that really at all. And so,
So Dr. Willardsen, question. So from the case, this patient that you showed us, how can that be fixed? Like, what would you do in that scenario? Would you just extract everything and then?
So the extractions have been done, and this X-ray that we're looking at here is what he has right now. I've actually, we're going to be putting in 4 more implants so that I can actually give him a better design of the prosthesis. But again, I mean, I've got really short implants, like on the upper right-hand side. It's just kind of all over the place. The parallelism isn't there. They're kind of just put in randomly. And I'll be able to restore this case no problem, and I'm very confident in the outcome. But the problem is it's been over a year and he's spent a ton of money. So he's spent so much money just to get to this stage, and now he's got to go through and finish it, right? I mean, he didn't get implants. He wants teeth. Like, he wants to be able to eat, he wants to be able to smile. Implants are a means to an end. It's not, it's not something where you get implants and then you're done. And oftentimes within this broken system, that's what happens. So the surgeon places the implants and it's like, okay, I'm out, I'm done, I'm good. And without considering what the patient wants, which is teeth, we see this all the time. We really do. We see this a lot, where the patients end up with really stuck in the middle of this broken, and it's a political system. It's a system where, within the dental community, it's just kind of a known system that you refer out to the surgeon and then you get the case back. But again, I go back to that initial consultation. Whoever sold this case, initially, what was their plan? Where were they headed with it? But obviously they didn't have a plan. So anyway, so moving on here. So another case here where, so if you have questions or comments, about this case or your situation, go ahead and ask us in the comments, and we'll be happy to address those as we're going along in our live stream here. So
Yeah, if you have like your own X-rays and you'd like Dr. Willardsen to review those and kind of see where you're at, like he mentioned, we have quite a bit of people because of our YouTube channel from all over the country, actually all over the world. We've had people from like Sweden reach out to you and send us an email of their X-rays, so to see if you can kind of fix or if there's an option for what they currently have, and you always usually do, and they fly all the way over here. So we'd be happy to have Dr. Willardsen look at your X-rays, and if you guys want to do that, send it to info@trustimplants.com. info@trustimplants.com.
Yeah, for sure. I mean, I'm happy to look at your situation, or if you have a question about if you're in the middle, or if you've been in this situation, if you're in this situation, shoot us a message, and we'll reply and try to help you through the process. Because at the end of the day, we just want what's right for the patients who are needing this work, and to try to help even the practitioners and the industry to move away from this scenario. This is kind of a classic and typical. We can see here the patient has certainly spent a lot of money, but not an outcome that they would consider, that they wouldn't even have a clue that that's where they were going to be, a few years down the road. So I just kind of want to go through this because as I've looked at whether it's in the lab and what other doctors are sending to the lab, and kind of where who should be the quarterback, where they're at and what they're planning. It's if I was a patient and I ended up with these 4 implants, and now this is a bar that's on the 4 implants, and they're getting like a removable denture, I don't think that they would have gone for implants if they wanted something removable. But because the doctor, just because the doctor had planned that out, that's what the patient's going to get. So in this model, or this picture here on the right-hand side. So here's after a few years, prosthesis breaks. This is a titanium framework with plastic denture teeth on top. And so very typical. It's what the corporate all-on-4 centers, that's kind of their go-to prosthetic. And so it's very susceptible to fracture. The bond between the titanium and the plastic, there is no bond. It's just a mechanical bond. There's no like physical bond with the material. So
Our first comment from Hugo Chavez right there.
Yeah.
If you want to just go over that.
Oh, he's watching in North Africa, Algeria. And he says he has a bad situation. What is your situation, Hugo? I don't know if you can hear us, but we're happy to answer any questions like that. And this is why we're doing this. This is, patients who are looking for, any solutions or scenarios where they're kind of stuck. This is why we're doing this. So
I would say also like just assistance. Like if you can send in again your X-rays, or just email us separately, so that Dr. Willardsen can even do like, over the phone or something like that. It's just, he can't be everyone's quarterback, but he can kind of assist one with another. Because he's like, everything that he's talking about right now, there's just so many practitioners who don't really understand the full process that you need a quarterback. And so if we can be that means to where you go to Dr. Willardsen and ask for assistance, like, can you refer someone in this area, or should I come out, or anything like that, that's what this live stream is for. Yeah, absolutely.
So he says he's had some bad experiences with general dentists, and there's no, I don't know what the politics, because every industry is driven by politics. Unfortunately, medicine, dentistry, everything. So I don't know what the politics are in Nigeria. I'm sure there's some excellent dentists there. I guess it's Algeria, not Nigeria. I need to get out a map, I guess. North Africa, Algeria. So, it's obviously, we would be happy to help you here, but it's probably not logistically it's probably not feasible. But if you have a doctor in your area and they want more information, because we do provide both surgical, prosthetic, laboratory content and information and education for doctors that are either just getting into implant surgery, prosthetics, or wherever they're at on their journey, we can definitely help them. I guess he's a Canadian citizen, and he hopes to fly to California. We would love to have you here. We would be, we'll take the very best care of you. And so he says he's really stuck with bad teeth. Very common. We see it all day long. I could show you photos of cases where we've seen all scenarios. And we love it when we're able to make that transformation from where their mouth is completely broken down. And I'll show you some really beautiful cases of that, to where the fully restored. Once their mouth is restored, their smile is restored, the mechanics, the functionality is all restored. It's a problem that is now gone. They don't have to deal with it anymore. And it was such a huge problem for them. And you patients who have what I'm talking about, whether it's broken down mouth or losing teeth, missing teeth, periodontal disease, you know what I'm talking about. So you've been there, or you're there, where you're afraid to smile, you cover your mouth when you smile, things have just broken down. So, and once that is restored, that problem is solved. So, they say that the dental implants it's like your third chance. So you got your baby teeth and then your permanent teeth, and once you lose your permanent teeth, luckily we've got implants, so it gives us one more shot at giving you back your smile. So
yeah, I wanted to just kind of bring that up, what Hugo said. He was going to go either to Colombia or Mexico, but now that he saw his videos, he has faith that you can restore it. But let's talk about what your thoughts are on people going to Colombia and Mexico. Let's talk about, because that's
yes,
big.
That's a great question. Let's look here at this X-ray. This is a patient that went to Mexico, got some implants, and you can see when you're looking at the picture on the, I guess it'd be the right-hand side, but it's really reversed. It's the patient's left. And so he's got some implants that are failing. If I look at the bridge underneath, on the left-hand side, it's not fitting. The bridge he has here in the front, which was done in Mexico, it was fractured, broken in half.
Let's see if we can point at it with the pointer so we can show.
With the pointer? How can I?
With this.
They can't see the mouse.
Oh, they can't see the mouse? Okay.
I don't think so.
Okay, no worries.
Can you see the mouse? I don't think so. But anyway, so I'll do it with the mouse, but I'm not sure you can see it. So on the upper front here, he's got a bridge. So he's missing the laterals and the centrals, and they've bridged the canines and just connected everything. But, the bridge fractured, I think, within a few weeks. These implants are only about 3 months old. Bone loss around this implant. In fact, I've already taken them out. So, anyways, goes to Mexico, thinks he's saving money, but if you consider the travel time, he went to across the border 12 times. So, at the end of the day, I'm pretty sure he lost money in this process. And then ultimately ended up in my office, and we've restored his case, and it turned out beautifully. So, so that's something we do see here in Southern California, patients going to Mexico, and there's some good doctors there. I mean, there's a street in one of the towns, it's all dentists, and so a lot of people go over there to have their work done. But when it goes bad, it goes bad,
And then when it goes back, like at least here, you can go to the Dental Board of California, and they can kind of help see what's going on. There's more of some type of like authority over it.
Yeah.
And who do you go when you're over there?
Yeah, if you go to Mexico and if it works out, great. But when it doesn't, that's he's going to send us an email of his teeth. So
see if you can reply with info at Trust Implants.
Down here?
Yeah, right there. So he has our email. And, anyone else too can send in their X-rays or any, like he's saying, he's sending a CD of his teeth. Maybe we can reach out to him and give him the address of the practice so he can send it out.
Yeah. So Again, I'm not criticizing Mexico at all or the doctors there, because there are some really good doctors. In fact, there's even doctors that were trained at Loma Linda that are there. But it's just there. Who knows if you'll end up in one of the offices that have qualified surgeons and prosthodontists that can do these cases. It's just kind of a risk. You don't want to spend, for one, I look at bone as, especially in the work that I do, it's so valuable. And to run the risk, to save a couple $1,000s, but run the risk of possibly, he's lost a lot of bone. I had to regraft that entire ridge on the lower left-hand side. It just was kind of not ideal. Whereas had he come to me, put good implants, good high quality implants in with proper technique, surgical technique, because implant surgery is a very, very delicate procedure. And so, if I can manage that, even if he spends a little bit more money, the case, 5, 7, 10, 15, 30 years down the road is still intact. And so he's gotten so much value out of that, What can you buy for really so little that lasts you that long,
Yeah. Well, that and other things that people don't consider, like the fact that you'll be able to chew more things, digest things better, so like your overall health is just going to increase, and
helps with digestion, with confidence, just your confidence.
That's the one thing,
I mean, if we look at this case here, so here's a before photo of a patient, and her mouth was pretty broken down. I mean, it was, and it didn't happen overnight. If she would have gone to like some of these centers like Nuvia or Clear Choice that claim they're getting it done, and like Nuvia claims they're getting the final prosthesis in 24 hours.
That's insane.
And they may be able to do that, but they're not looking after what's best for the patient. This case took us 1.5 years. So can they see this, Dennis, both images? Or do I have to transition over? So this case, no, it wasn't a year. It was about a year. I think it took about a year. But I mean, just look at that outcome. I mean, complete transformation. It's solid. The bone is solid. Implants are solid. Implants are in a great position. There was just no compromise at all. And this is going to be it's a tremendous value and a tremendous asset for her, moving forward. So, and she says that. She's like, I'm so happy. I love my smile. I have confidence again. I can eat. And so it's, I sleep well at night knowing that I've done the very best that I can do on every single patient that I work on. So, all right. So that is kind of a before and after shot of what you can expect. Now, from the before to the after, it's a process. It doesn't happen overnight. It's not, because every case is different. I would never I would never advertise that I'm going to have you come in and in 24 hours deliver a final prosthesis. And so it's just because you can't throw that out there and think that every single person that walks through your door you're gonna be able to do that on. There are some patients that got tons of bone, and they've got different scenarios where I can load the case immediately or put the teeth on immediately, but it's just not for everyone. I'd say maybe 20% of the patients are can be immediate load type situations. So
20%, you'd say? And what determines that?
Bone density, available bone. Like in her case, she had so much infection, like where her teeth were. I had to extract everything, graft, wait for that graft to heal. And that's very common. That is really, that's really what I see on a daily basis, is patients coming in with a lot of infection, the bone's completely pulled away from the tooth. And I have to rebuild all that in order to give them a really secure long-term prosthetic on really solid implants. So whether it's, periodontal disease or traumatic occlusion, a lot of times they've lost their back teeth, and so I don't know, every patient's different, and I'm just, thinking about all these patients in my head because I've done so many of these. But anyways, all right, moving on. And again, Hugo, thank you for your questions here. we'd be happy to see you and help you, and would, even if it's supporting the doctor you choose in your country to help you with your transformation and your implant prosthetic transformation. All right, so here's another case. Patient's got 8 implants in the upper jaw, and I had to graft the sinuses in order to get implants in those back areas, but lots of good support. When she chews in the back of her teeth, where all the load and force is, I say it all the time, but she's got implants there, so she can be assured that there's going to be security in that. And this is a patient, I mean, she doesn't have, a lot of money, but she sacrificed and made the sacrifice to get what was best for her. So, all right, so this is just her after photo. Okay, now, all right, so again, yeah, if you can send x-rays in, if you have images or something that you can send in, we can kind of guide and help you to move forward with that. Now let's talk about kind of moving on. Let's look at situations where we see this quite often too. A patient, falls on their skateboard, or they've knocked out their front tooth. I've had to do this quite often, where we have to extract the front tooth and then place an implant. And the only reason I show this is because I want to show how delicate the procedure is and how delicate the tissues are, but when managed properly, it's very predictable. And so let's see. So here's, before, when so as you're looking at the image, it's on the right side, but it's actually patient's left. Tooth is fractured, but the crown is just kind of sitting there, but the tooth itself is actually fractured underneath. And so we went ahead and removed the crown, and you can see the whole tooth is broken underneath there. In fact, it's inside the crown, the majority of it. So I need that video, Dennis. So we went ahead, of course, we went ahead and extracted this front tooth. And so you can see there, we elevated the root out. And this is the point that I wanted to, the video is not great, but it kind of gives you a good view of. You'll notice the architecture. The architecture is the gum tissue, the bone, everything around this front tooth needs to maintain integrity. You want to keep it intact, which I've done. So we take the tooth out, pull the root out, make sure I have the entire tooth. I don't want to leave any shards or broken pieces, like the tip of the root a lot of times can come off. So, and then I irrigate, clean out, what we call degranulate the site. So we clean all that, the extraction site out. And then I start to prepare the hole or the osteotomy for the implant. And again, you'll notice I'm maintaining the architecture of the front tooth. So the gum tissue, I don't want to make an incision there. If I can avoid it, a lot of times I have to. I don't have a choice because I've lost like the buccal plate of bone and I have to regenerate that bone. So,
what's an incision?
With a scalpel. So a lot of times I would make an incision from side to side and then pull the flap or the gum tissue off the bone. If I need to graft the front side of the tooth, then I would reflect that back. But I used an Explorer or a perioprobe, and I could feel the bone all the way intact. So I knew all the bone was intact, and that's why I was able to place the implant here. And so, anyway, so I started with a pilot drill, took an x-ray, made sure I was in a good position. And, there's just certain steps that you want to take, but at the end of the day, I mean, this is immediately extracted, so immediate placement. So I extracted the tooth, cleaned it up, bone graft, placed the implant, and then you can see here I'm putting the implant into the osteotomy or the hole. So,
and for let's say a single implant like that, how long does that take to heal?
So this case, I had like 70 Newton centimeters of torque on it. Yesterday I did the surgery, so I can put a tooth on it right away.
Oh.
When I have that much torque, I can load it right away. So
because there was enough bone, right?
Enough bone. it's all kind of autogenous bone. It's a patient's bone. There is some graft in there, but this is, you know, a pretty slam dunk, straightforward case, which is great. Usually not the case. I usually have to do a lot of work to get these anterior front teeth to look like a tooth rather than an implant. So here I'm torquing the implant into the osteotomy or the hole. This is a Nobel Biocare, Nobel Active, or Thai Ultra, actually, their new implant. And so I've got plenty of torque on this implant, and it's driving. I can feel it drive into the osteotomy. I can feel it advancing into the osteotomy. But I started the process of doing this. I started one with a plan. I knew where I was headed, and two.
Oh, that's all the way in, huh?
Yeah. So it's buried pretty good in there. You can see at the apex of the top of the root of the implant, up at the top, it's in good solid bone, and I've maintained the integrity of the architecture. So the gum tissue, the bone, all of that has been maintained. And so really important, because when I go to put the crown on this tooth, this is a young lady that I think she fell and busted out that crown years ago. But then ultimately, after a root canal, after all this work to the tooth, all of that kind of broke down, and we had to replace it because the root fractured itself. So anyway, so the surgical aspect of the placement of the implant is very delicate, and the bone has to be treated delicately. It's kind of sometimes it's delicate, but sometimes I use osteotome, which it's like a mallet, and that it expands the bone. It expands it rather than removes it. Two ways to place implants. One is I can drill to remove bone, or two, I can compress the bone. It's osteocompression. So, and so here we have the implant placed. And so this will be I have not restored it because this was literally yesterday. So, and so we're going to let that tissue heal, let the graft heal, and kind of let things settle down a little bit, and then I'll make the impression and put the crown on. So
We have a few people here that comment, so that thanks to Sturm and Sun Plumbing, and then we have
great.
another question right there, I think, from Katerina.
Somebody in Russia or something. She says, I have a question. What are the key steps in dental implant procedure, and what can patients expect? So, Katerina, that's a great question. A little vague, only in the sense of every patient is different, every case is different, every implant is different. Well, notice this is just one implant, so a tooth in the front, and how I manage that is very different than an implant in the back of the jaw. It's a great question what you ask. What can patients expect on a broad scale? What are the key steps? The steps are, the first step is making sure that you've got a quarterback or a dentist who's going to restore the case, whether it's a general dentist, prosthodontist, even some oral surgeons are getting into the restorative aspect of implant dentistry. Making sure that first point of contact has a good plan. They know where they're heading. They know what the outcome is going to be and what their end goal is. Look at photos of that. Really be solid and sure that they know where they're going and that you know where they're going. That you can confidently say, yeah, this is. Look at a case or a model or whatever to show me, okay, where are the implants going, how many, and what does the prosthetic look like when it's all done. And so, you can expect a really good outcome if that initial doctor or point of contact knows where they're headed. If they don't, you can get a decent outcome, but it's not as good as if they are truly solid on their plan and where they're going. So, all right, they can expect good results if that's the case. Implants work, they integrate. It's so amazing to me to watch as I put foreign materials in the body, and I've said this before, but and then go back in and uncover, expose the implants and just see that bone just fully integrate around the implant. It's the, how amazing the blood, the bone, the proteins that we have in our blood, the BMPs help in this process of allowing foreign objects to become part of the body. It's pretty remarkable. So, and to me, it's a testament to God and that He works with, He created us, and as we obey those laws, and if I obey surgical laws and I understand what they are, I can expect a good outcome.
Right.
And so now if I break those laws, or if I burn the bone, if I drill too hard, if I'm not delicate with the bone, and in that, in that case from Mexico, those implants that were failing, I have no doubt that that was the case. He drilled too fast, burned the bone, killed the bone, and then puts an implant in this bone that's now dead, and within a few months it all dies back and the implant comes out. So, and that's why I say, to save a little bit of money, because actually you don't save anything by going, somewhere, and it could even be in the United States. If the person placing the implants is not trained in implant surgery and has a good solid foundation, you can end up with really bad, spend a lot of money and effort and not get what you want. So,
I mean, we've talked about this quite a bit in this channel. We talked about doing having patients do the research, looking at their oral surgeon, or whoever's their quarterback, whoever's taking care of their case, really look at their background, where they studied, how many cases they've done, how long they've been in the industry. Because if it's someone who's doing, he's only in case number 5, full mouth, or someone like you who's done more than 10,000, you already know. It's kind of like an athlete. They've taken that shot so many times that it's a lot easier for someone like me to take a shot. So that's kind of what they have to look at the end of the day, I would say.
Yeah, no doubt. I mean, it's so, the procedure itself, because you have two parts of this process. The surgical aspect, which is a completely different entity than the prosthetic aspect, meaning the fabrication of the teeth. Ultimately, again, the patients want teeth. They don't want implants. Implants are just the anchor that I can attach the teeth to. So the goal is to give them teeth. So you have to start the process with knowing what the end is. So, and then as far as the surgery is concerned, having training and knowing how to, manage the bone, the soft tissue, the grafting, working around the sinuses, the nerves, so that you can end up with a good result. Okay, so, all right, now, a lot of times I'll have patients ask, well, first of all, when I'll get a patient, and oftentimes there's so much infection in their teeth and bone that they, it's of course from neglect. And a lot of times patients will lose 1 or 2 teeth or multiple teeth, kind of feel like, oh, what's the point? What's the point of even brushing the ones that I have left, because things are falling apart anyways. And so by the time they get to me, they're, it's kind of like a bomb went off in their mouth a lot of times. And so now I have to figure out, okay, how are we going to reverse all this, get the teeth out, regenerate the bone, place the implants, and then give them a new set of prosthesis that's going to last them and be a good investment. And they'll say, well, I have implants now, so I don't necessarily need, implants aren't susceptible to decay, of course, but they are susceptible to periodontal disease. And so I only want to show this because I do want to kind of show that it has to be maintained. Once you've made this sort of an investment, you want to maintain it so that it'll be something that lasts for the rest of your life. So,
and this is periodontal disease.
So this is a case that we delivered. Well, first of all, the patient, when I first saw him, I'd have to upload those photos, but he came to me, his mouth was kind of a mess. We pulled all the teeth out, grafted, implanted. And so we're talking, a process of about 9 months in this case. And so the only reason I'm showing this photo is because this was at his post-delivery. So after I put the teeth in, follow-up, and he comes back in, and I'm like, he's not maintaining this. You can see all this debris underneath the bridge. And so he's kind of fallen. He's happy that he has his teeth restored and everything's back to normal, but he's kind of falling back into those same habits of not maintaining now his implant. So you have all this money invested now in your mouth. You got to maintain it, and it's not hard. I mean, you just got to brush, get a water pick, irrigate, and just do. But sometimes when they have those habits, they've never broken them because he never had the opportunity to break them. Because when he came to me initially, and we wrote up his treatment plan, and then we did his case under general anesthesia, we extracted everything. He never had to brush, from that process. So we went from, bad teeth to extracting those bad teeth, and now to implants. So I only show this because, and he now is better. I've seen him since, and so he is, kind of put down the law. I'm like, look, you got to maintain this thing because you've spent so much time, effort, and of course, money and investment.
Money. I would say that should be it. That should be the...
And so, anyways, so it's not the case where if you get implants, you don't have to maintain it. Implants are susceptible to peri-implantitis, around the tissue inflammation around the implant if they're not maintained. So they definitely do need to be maintained. So, and we appreciate everybody's questions. Keep them coming, and yeah. So, but let's look at where's our? We got some. Bear with me again. We're just kind of learning how to do this. So, all right. Let me transition over to here. So in the beginning of our live stream, we were showing some cases of from some of the corporate all-on-4 centers, and it had a titanium framework with plastic teeth. Whereas here in our practice at Trust Implants, we only use zirconia. I haven't done it's called a hybrid. So it's a hybrid, meaning a hybrid of titanium and plastic. So that's where the term hybrid comes from. And that's 90% of all on-4 cases are hybrids or a small titanium framework with plastic teeth. And so those photos that I showed, maybe I can go back. Don't know if I can. Hold on, let's see. Yeah, some of these photos, oh boy. Oh yeah, here we go. Okay, so if you'll notice here, so this on the left-hand side or the right-hand side of the picture, you've got the bar that's broken. And then you'll notice down here, this is all plastic on the bottom, plastic teeth, acrylic, and then underneath that is this titanium bar or framework. And so he's broken the entire framework off on the top. If you'll notice, inside the implants are in these multi-unit abutments. The screws are all fractured inside there. The bar's broken. The teeth are broken off, of course. I mean, this is just again, it's like a bomb went off in his mouth. And I talk about the biomechanics. I go over it over and over and over, but biomechanics are so important. And this is a really good example why. All of the load is here in the front where the implants are because they've concentrated these in. I did not place these implants. I didn't do this case. I got the case through this, basically. I mean, by the time the patient got to me, his lip was all torn up from chewing on these metal or titanium bars, And so we just put a plan together. I extracted this tooth back here that they should have extracted from before, put in a couple more implants, and then restored the case with a full zirconia prosthesis. But again, I look at the biomechanics of the way this case is designed, and that all of the load is in the front, and that's how much load this, to break this titanium bar, break all the teeth, break all the screws, that's a lot of force, That's a lot of force. And so, and that's why I say, it really has to be, the materials have to be right, the implants have to be right, the positioning of those implants have to be right. The grafting, because a lot of times in the back of the jaw, the sinuses are back there, so you have to graft the sinuses. All of those things have to be right, and that's why I say from the beginning, the guy in charge, the quarterback in charge, he needs to know all of this stuff before you get to the final. If he does, we can expect, we can expect this. You can expect to have prosthetics that look like this. And this is what I do. This is how I deliver my cases. Aesthetics are beautiful, but I have good support. Notice these implants are all concentrated in the back. I don't really even have any in the front. I want all of my implants in the back as much as possible. At least, not all of them in the back, but evenly distributed along the arch so that where the load is, I have a support there. And then the other thing is how the bite or how the teeth come together is critically important. The articulation and how that is, both top and bottom. If everything is solid, when the patient bites down, the load is distributed throughout the arch and not just like in one spot, like that picture we were showing where everything is broken. Everything was concentrated in one spot. And when you have that much load on one spot, that's what happens, everything will break down. Yeah. And so, but when properly designed, properly planned, properly executed, this is what you can expect. And it's a great investment for patients.
Great. I think we have one more question from the same user. I think wondering if it's always necessary to...
Oh, that's a great question. Katerina, thank you. That's a really good question. So is it always necessary for patients to have their teeth removed? We get a lot of patients coming in that have been to some of these corporate all-on-4 centers, with Clear Choice and Nuvia and some of these places. And they come in and they'll say, oh yeah, well, so-and-so at this practice said, I need all my teeth removed. I had this on Monday. Patient had gone to Clear Choice and then came to me as a second opinion. And he's like, well, at Clear Choice, they quoted me $55,000 to pull all my teeth, do 4 implants on top, 4 on the bottom, and then make a prosthetic. And I kid you not, he needed like 3 teeth extracted. So that's not part of their wheelhouse. It's not part of what they do. It kind of breaks the cycle of what they know how to do. And so in the end, they were going to do what they know how to do on him, which was pull all his teeth out.
And so they do that just because it saves them time and it's
saves them time. It's easier. That's where the bone is. So where there's teeth, there's bone. And
good
so,
bone. So
good bone. Yeah, good bone. They don't have to graft anything. They call it graftless surgery. So I hear that term and it makes me sick. I'm like, I graft almost every implant. So I don't place an implant without having my grafting supplies out, my grafting instruments, material. I always have that ready. It's very rare that I don't place an implant and do a graft. Even on that video I showed with that extraction, she had pretty decent bone around everything. Technically, I could have not grafted, but I want to fill any voids around. So I pull the tooth out. There's a hole, and it's like this big. And I'm going to put an implant in that's about this big. So I want to fill, it's a tapered hole. So at the apex or the tip of the root, there's, really good solid fixation and really no hole at all. But as it migrates up, this is kind of a void here. So I want to fill that void with bone. But anyways, they call it graftless implant surgery. And it literally makes me cringe when I hear that term because it's just not, it's not possible to, it's just like trying to go like the cheapest, and it doesn't think about the long term at all. So anyways, I get sidetracked easily. Patient comes in, had been to Clear Choice. They recommended he have all of his teeth removed. Did not need all of his teeth removed with that by any. In fact, I would never even, if he came to me and said, I do want all my teeth taken out, I wouldn't do it. And so, because it's not, he could easily have his mouth restored without having to do that. So,
And these are great stories, Dr. Willardsen, because you hear these stories every day. But if one of our viewers goes to their doctor and they say that, they're just going to trust him. You know, they're just going to trust and say, fine, like take all my teeth out and let's do the whole procedure. But just by us bringing up these stories, that these are situations that are happening all over the world. You know, at least now they know. They're like, oh, okay, so this is happening, and we get patients in all the time, and they tell us everything, and going from Mexico, you know, going to all these implant places and getting these, what do you even want to call them, like, not even offers, because they're just, at the end of the day.
It's not an offer, because they're doing what they know how to do, and that's it, you know? Yeah, so Katerina asks, let's see, can some be, I've watched many of your videos and I've seen how many patients have all their teeth removed and replaced with new ones. Is this always necessary? Can some teeth be preserved? Yeah, that's kind of what we were talking about, Katerina, is yes, a lot of times the teeth can be preserved. My rule of thumb is, let's say I have a patient, they've got like 6 teeth left on the top and even 6 or 8 on the bottom, but then some of those teeth have had root canals or are infected. If I end up like with 2 or 3 teeth, and let's say those 2 teeth are good, at that point, there's no point in leaving 1 or 2 teeth. So at that point I say, yeah, then let's take them out. But if they have 8 or 9 teeth that are all good, there's no point in extracting those teeth. Work around those teeth, rebuild the teeth if you have to, but put implants in where they're missing teeth. And that way, you know, nothing is as good as your own natural teeth. Nothing. I don't care what anybody tells you. Implants are great, and that's what I do, but my worst nightmare is I'll wake up in the middle of the night dreaming of my teeth coming out, because probably the day before I extracted somebody's teeth. So that's my worst fear, is losing all my teeth and having to have implants and a prosthesis. But so having your own teeth is by far the best approach. So, but these corporate centers are not geared towards that. They just don't have the means to look at each patient individually and give them an individually tailored treatment plan. One, because they're bought by these big corporate venture capital companies, and so they have marks they got to hit. And that's why I say the system is broken, because if you step outside that corporate scenario, now you're back in the private practice. You've got a general dentist trying to manage and deal with prosthetics that he has no idea how to do. And then you've got a surgeon who wants to get the implants in, but then he wants to be done with it, like kind of clean his hands of it. And so the system is broken, and it's the patients who suffer with that. Here at Trust Implants, I'm trying to bridge that gap between the broken system and the corporate all-on-4 centers, you know. And so, well, it's we're at 10 o'clock, and I think we've had a good conversation. Thanks, Memo. Thanks for being here. And it's a, you know, this is our second attempt. I know it's, you know, we're a little rough around the edges, but hopefully as we do this, we'll get better. I do have a lot to say, as you can see. I've, you know, very passionate about this. I've got literally tens of thousands of photos and videos and content that I could talk about it all day long. But in the end, we want what's best for the patients. That's you guys. We want these corporate centers to kind of change their mindset, which they never will, because they're all driven by by money, and maybe help the private practices, the ones that are trying to meddle in this, have a place to go to where they too can ask questions. You know, they can, if a doctor is struggling with a case, I am happy to help them walk through that case, because it's, you know, it's not easy. It is not easy to do these cases. In fact, another case from Las Vegas, he comes out and he went to go see his doctor, who's actually a prosthodontist, that is trying to solve his problem. And he basically told him yesterday, because the patient called me yesterday, he says, you know, James, I just can't help you anymore. You know, and his case is very complicated, but anyway, so we're happy to help other doctors who are trying to get involved with this or have been forced to get involved with it. And even surgeons, you know, implant surgery, and, you know, some surgeons are getting into the prosthetic aspect of things. So that's really what our goal is here.
Yeah, no, of course.
So.
And I would say to the chat or all the viewers from now on, we're going to continue to do this every Wednesday around the same time. But take advantage that Dr. Willardsen's willing to just kind of share and be honest about everything. You know, we're eventually going to have questions from all over the world, and a lot of those, like, we really don't gain anything. You know, I mean, it does help our channel and kind of our brand grow, but just the free information that you're giving out, I think that's more than enough. So
for sure.
Yeah.
All right. Well, thank you guys for watching, and we'll be on again next week, and we'll have more cases, more information, and look forward to that. Thank you. Okay, well, we should have like